Madam President, this past Saturday, open enrollment began for the second round of state-based and federal exchanges all across the country. Think about where we were a year ago today. The government was in shutdown. The federal webpage where people went to enroll was a blank screen for many, frustration all across the country, and a lot of folks, a lot of our friends on the other side of the aisle claiming that this was proof that the healthcare reform law could not work, that it was a failure from the beginning. Well, a year makes a big difference. A year later, and we have 8 million people who have insurance on these exchanges across the country. We've lowered the number of people without insurance by 25% in a year's period of time. That's remarkable. In my state of Connecticut, where we've run the best exchange in the entire country, we've cut the number of uninsured in half in just a year's period of time. That's even more stunning number. Healthcare rates of inflation are as low as they have been in most of our lifetime. The state of Connecticut is actually spending less on Medicaid than it was a year or two ago, and quality is getting better by most all of the indices that we follow. The number of people who are readmitted to the hospital after a surgery, or the number of infections that people get while they're in the hospital, they're all lower than they were when the bill first went into effect. And well, a lot of my Republican friends come down to the floor with stories of people who have bad experiences with the health care bill. The data clearly is on our side. The data tells only one story, that the Affordable Care Act is working. But we have a lot of stories too, millions of them, as it turns out. And I've never denied that there are going to be people that will continue to have bad experiences with our healthcare system. There will be people who have bad experiences with the Affordable Care Act and with the exchanges, but they are in the vast minority. The majority are people like Christina, who's a small business owner from Stratford, Connecticut. Several years ago, Christina left a job that provided employer-based coverage to start her own business in Bridgeport. This is her dream, to start her own business. But like a lot of Americans who have a dream to start their own business, she was reticent about doing it because she was worried about losing her health care insurance. Well, she stayed insured on COBRA until it expired, and then at that point she had to go into the individual market. She recalls having to fill out a 15-page questionnaire asking about, as she says, quote, anything that I had ever even remotely discussed with my doctor. And unfortunately for her, she got a rejection notice from a carrier that basically just copied and pasted what she had wrote in the application and said that here's your pre-existing conditions and that's why you're uninsurable. Her only remaining option was to go into Connecticut's high-risk pool. And as she was shopping around for insurance, she decided to get her annual mammogram at age 40. And the hospital let her know that they found something on that mammogram, something suspicious. Facing a potential cancer diagnosis without health care coverage, it created an enormous amount of anxiety for her. And it was at that moment that it struck her how important it was for people to have coverage. So she went to Access Health, which is our state-based exchange, to look at plans. And she realized that she had another option. She found a gold exchange plan. And it asked her to pay $430 a month, which was a big difference from the $1,200 per month that she was paying under the high-risk pool. By the way, a lot of the repeal and replace crowd say that you should replace the exchanges with high-risk pools. Well, for Christina, the high-risk pool was a big financial risk to her, $1,200 a month, down to paying $430. And she says this, she says, I'm thankful that there was a solution for me to be able to keep my business and have affordable health care insurance that can't be taken away. Now, Christina hopefully is going to be what a lot of people call job creators. She's hopefully going to hire a lot of people for her new business. And she's going to do it because she was able to start that new business because of the Affordable Care Act. On Saturday, the first day of enrollment, HHS said that 100,000 people submitted applications for coverage. And more than 500,000 people were able to log on to healthcare.gov. And more than 1 million people, just since open enrollment has begun, have been window shopping for insurance options. By and large, websites across the country are working, and they're allowing people to come back and shop for plans. And it's really important that people do come back and shop for plans, because what we know is that the insurance industry likes this bill as well. Now, a lot of people on our side of the aisle don't like the fact that the insurance industry likes this bill so much, but they like it so much that there are about 25% more insurers that are offering plans on these exchanges. So if you were on a plan for the last year, you should just know that there's likely more options out there for you. And so you should go on to your state exchange or onto the federal exchange and check it out. There's going to be more options with potentially better fits for you. Now, that's not to say that people haven't been really happy with the insurance coverage that they've got. Here's some other news that we've gotten in since the last time that I was on the floor. The Gallup poll surveyed Americans who had bought insurance in the first year on these plans. And what they found is pretty remarkable. 70% of the people who bought insurance in the new marketplace last year rated it as good or excellent. Would that we had the same ratings for the United States Senate. 70% of people say the coverage that they got was good or excellent. 3 in 4 of the newly insured said they're satisfied with this aspect of their healthcare experience, and that's compared with 61% among the general population with insurance. So people are actually more satisfied on exchange-based plans than they are on non-exchange-based plans. If you're satisfied now, you may be able to get an even better deal because more insurers are now signing up. The other good news is that premiums are going to be, on average, lower. Now, that's an impossible thing to say in the current healthcare environment. People are just not used to hearing that premiums from year to year are going to be lower, but that's the truth. A study from Kaiser and a study from the Wakely Consulting Group. Kaiser looked at the second lowest cost silver plan in 49 cities around the country and found that premiums are going to be decreasing slightly from last year. Wakely looked at the largest county in each of the 34 states with marketplaces run by the federal government and found on average that the rate decrease was going to be 1%. Now, we frankly would be happy if the rate of increase was only 2 or 3%, because on average in 2008, the premium increase was 10%. In 2009, it was 10.8%. And in 2010, it was 11.7%. We're having an average premium decrease in the exchanges this year. More proof that as folks get more coverage, as people get access to preventative care, they are driving down overall healthcare costs because less people get into crisis, less people have to run to the emergency room, they get cheaper cost care earlier on, better for them, better for the taxpayers, better for their bottom line. Kara from Granby, Connecticut, has this story. When Kara was born, the doctors immediately told her parents that she was going to face a lifetime of obstacles because she was diagnosed with only one ailing kidney and a slight hearing impairment. Luckily for her, her parents found a great doctor at Connecticut Children's Medical Center. By the time she was 10 years old, her one and only kidney had started to fail, unfortunately, and a kidney transplant was recommended. Her father gave her one of his kidneys, and she was able to graduate high school and college without having any major healthcare problems. But she remembers always being warned by her parents about how difficult her life was going to be because of her healthcare ailment, but also because of the fact that her life decisions were going to be dictated by whether or not she could get healthcare. And so she was so relieved when she found out she could stay on her parents' plan until 26 under the new healthcare law. It was critical to her because her health, after she graduated college, took a sudden downward turn. She began having frequent headaches that never seemed to go away. Her voice became really hoarse. And what she thought was a virus ended up to be diagnosed as a brain tumor. Because of the ACA and her parents' insurance, she was able to get great coverage. Now, she went out to go look for a job, but wasn't able to find one that offered health care insurance, and she went on to Medicaid before she could sign up for health care insurance herself. Her tumor reappeared, but even despite this latest setback, her doctors still believe that they can extract the tumor and the prognosis for Kara is good. But she has health care. She has had continuous health care because of the Affordable Care Act, because of Medicaid being expanded throughout the states. Kara says that I know for sure that I wouldn't have made it this far in life without health care. It's incredibly essential to have it. You never know what's going to happen to you. Don't take your health for granted. Cara from Granby has health insurance because of the Affordable Care Act, has had it continuously because of the Affordable Care Act, but differences are being made all over the country. So I'll tell you just one more story, and that's one from the middle section of the state, from Ohio. Jim worked for 37 years for the same company. He was typically putting in 50-hour work weeks that included travel and working weekends, and it really started to take a toll on his health. And he knew that he had to retire. If he wanted to live longer, if he wanted to enjoy his years in his 60s and 70s, he had to retire. But he couldn't do it because he needed health care for him and his family. His wife is a cancer survivor. She had been diagnosed with leukemia 15 years ago, and the only way she was going to be able to get insurance was through his employer. So he had to keep working, even though it was the wrong thing for his health because of his job lock caused by his necessity to get health care insurance from this job that he was connected to. Well, the Affordable Care Act changed all of that. He retired in March of this year, and he went and did his homework on healthcare.gov. The plan that he chose would have cost him $1,200 per month to cover him and his wife, but with the subsidy that he received, with the tax credit he received, their premium costs were $127 a month. Now, Jim's shopping as we speak for plans in 2015, but he knows that he's going to live a longer life, that he's going to be able to be there for his wife and for his family because of the Affordable Care Act. Jim's got a pretty interesting take on all of this. He says that he got to leave his job and spend more time with his family and spend more time concentrating on his health. He says, quote, "I'm much healthier and happier than I was before. Plus," he adds, "I'm helping the economy. When I left my job, they had to hire someone else. So I'm a job creator too." This is one of the great benefits of the Affordable Care Act. It reduces job lock, people who have to stay in jobs. People like Jim, but also people like the first woman we talked about today, Christina, who was able to start her own business because of the Affordable Care Act. Open enrollment is upon us. People have 25% more options. On average, they have premiums that are lower than they were last year. You can sign up for something better than you had, or you can join the 8 million people who have signed up on the exchanges and participated in Medicare expansion all across the country. You can be part of this pretty amazing story that is being told all across the country. An Affordable Care Act that is ensuring more people than ever before in this country, is contributing to a stabilization of healthcare costs all across this country that still leaves us with a lot of room to go. Still way too many people paying way too much for healthcare, but at least charts us in the right direction and is making people healthier all at the same time, which is really what this is all about, right? It's not just about saving money, it's about allowing people a better quality of life, and it's doing that as well. As we mark the coming second week of open enrollment, Madam President, it's important again to point out a very simple fact, which is that the Affordable Care Act works.